Holy hell, Batman. I am in Tennessee at my house, out of the camper. I've got a 45-day break. I think I'm on day 13. I used to love these breaks. Now I'm losing my fucking mind. I'm ready to go back to work. So while I'm bored out of my mind, I thought I'd do another TRT update. Um, the the big thing to tell is you can see my previous video what had happened to me. I want to throw a couple caveats in there to the first video, starting with when I said that I was debilitated after a 12-hour shift. So, what I meant was I would wake up in the middle of the night, maybe like 2, 1 o'clock in the morning. Again, no matter how hard I worked, shins, knee pain, leg pain, hip pain, lower back ache, and it's not like it wasn't excruciating pain, but it was just a bad ache, and I had trouble going to sleep because of it. And it wouldn't matter 1, 2, 3 days in a row. When I started taking the testosterone, it fixed all those issues. That doesn't mean that I'm superhuman, and after 3 12-hour shifts in a row, I'm like the fourth day on my first day off, I'm like, I feel incredible. I'm the king of the world. No, I mean, you still have the normal aches. Like on my first day off after a 3 day stretch, I'll still sleep or I'll stay in bed for like 7, 8 hours being like, I immediately regret this decision. But so anyway, so what else can I go into? So I'm getting treated in 2 locations. So I think it's TRT Center is what it's called, or Low T Center, something like that. It's in Dublin, Ohio, and it's in Johnson City, Tennessee. So the one in Dublin, Ohio, every time I've went to go and tell them to lower my dose, they're like, no, your balls will, your dick will fall off, you'll get Ebola, and bad things will happen. No woman will ever love you. I'm paraphrasing. That's not what they really say. But started off 140 milligrams. That testosterone was, I think, 653 or 675, somewhere around there. Then they upped me to 160. My testosterone actually dropped to 575. They said, well, your balls have atrophied, so that's probably why. We need to go up higher dose. And I said, no, we're not doing that. Immediately after the 160 milligram testosterone cypionate, I felt worse. Not like I did before I ever got shots, just I didn't feel right. So after much goading, I told him, like, look, drop me back down to 140 and we'll retest. So they did that after, I think, 3 weeks or a month, whatever the time is. They redrew my blood. My testosterone went up to 720. So I'm like, oh, okay, so less is better. And again, this is not medical advice. I'm just telling you my story. So sometimes more is not always better. Continued on that for a little bit. My estradiol was 46. I'm taking a Ribodex 0.5 milligrams on day 2 or 3 post injection, and my estradiol started at 46 when they first tested it. I'm sorry, on testosterone. The first estrogen level was 46. They put me on the Ribodex. A Ribodex only dropped me 1 point. So I also, I mean, I don't know this for a fact, but I think it's because I'm getting too much testosterone. So 140, ask him to lower me to 120. No. This is in Dublin. This isn't a knock against them. They got to do their protocols, but they were like, no, your dick will fall off and you'll get cancer. You don't want to do that. So I was like, all right, whatever. So I ended up, I left my work contract there and came home for my break and went to Johnson City, Tennessee, and told them, I was like, just drop it to 120. I don't care. And they're like, are you sure? I was like, no, just drop it. So I dropped down to 120. I feel better. I now know how a woman feels because the high part of estradiol is 40. If I'm at 45 or 46, whatever the level is, I have hot flashes, and they come on. I can't regulate my body temperature. I'm either sweating like a pig or I'm freezing. So, yeah, good times. What else? What else can I throw in this video? My cholesterol levels. So I have a baseline abnormal HDL good cholesterol anyway. Even when I ate clean, like nothing but salmon and tilapia, it's only 36, which is 4 points below the bottom end of normal good. So I'm out of whack there. And testosterone dropped it from 36 to 31. My LDL, I think, was like 104. And it dropped to 96, I believe. And testosterone can do that it will lower your good and bad cholesterol. What's the other thing? The other thing I want to tell people, and just from questions I've been seeing, and I also watched a video from another bald dude that he was just cussing like, if you're not seeing a doctor and you're just taking testosterone, you ain't on fucking TRT, you're on steroids. And it's true. Like there's a lot of factors to go into taking testosterone. And if you're not seeing a doctor and actually getting blood work done to see where you're at, you're not on TRT. So stop saying you're on TRT. You're just taking steroids. And that's fine if that's the way you want to live your life. If it's a financial, if it's financially cost prohibitive, I understand, but it's not TRT. So a lot of people come in and say those things. And another thing, like in the comments, people will say stuff. They'll ask questions and they'll say broad things. I can't give you an example off the top of my head. And one person in the comments on the last video said something. I was like, you need to do more research because you don't even have a base knowledge of what you're talking about. You're just spouting off. And why are you listening to some dude on the internet? Like, why are you asking somebody who's not a doctor and not a professional in that aspect, like what their advice is? Go do your own research and come back to me. Let's see, what else? So that's pretty much it. I'm on 120 milligrams now. I'm trying to lower my dose down to 100. I get retested, I think, in 2 weeks, and they're going to check my prostate and everything else. My PSA, I think is what it's called. That's it, man. I guess if you guys have any other questions, that's kind of my update story. I did a video, I think June 4th-ish. The main point to take away from any video that I do, if you don't take anything else away, is listen to your body. Your body will tell you what's going on in most cases. So if you go into a clinic and they're insisting on something you don't want to do, like increasing dose, decreasing dose, whatever, you have to be forceful with them. You have to say, I'm not doing that. You're not putting that in my body. I need less dose. I need more dose, whatever. I can't speak to the more dose. I just know in my experience that they were very timid about dropping my dose, so I had to force the issue. But I come from, it's a little bit like I know how this stuff works. Like I work in healthcare, so I know how to work the system as far as that goes, and that a lot of times you're putting your life in a professional's hands, and a lot of times you'll yield to that. And in a lot of cases that is true, but sometimes you've got to put your foot down and say, no, we're not doing that. Lower my dose, and I'm talking about in my case specifically. So be your own advocate. Do your own research, and that's it. Know what you're talking about and be forceful in your decisions, not physically, but verbally. Like, say, this is what I want to happen. If you can't do that, then I'll just have to go somewhere else. Now, NBC. Wait, hold on a second. The more you know. Peace.